Today I'm going to show you how to use stretchy-based tapes to actually decrease knee pain with medial meniscus injuries. If you're feeling knee pain right now, sometimes putting tape on simply as this can decrease your pain. Obviously you need to go see a doc. Stay tuned for this video. Okay, we're going to show types of stretchy taping. This is going to be for the medial meniscus. And scooch on a little bit that way. Good. All right, so I already pre-cut 3 pieces of tape. And this is rock tape, but you can use lots of different types of tape. So we won't spend too much time on this, but I'll show you a quick demo. So usually we do with the anchor one, we like to rip off about this much here, okay? And typically we find the area, which in this case we're looking at the medial meniscus. You slide down and we got to find an anchor point right there. So, oops, I shouldn't have done that. So here what we do is we attach it with no stretch there at the bottom. And what's going to happen is we're going to contour around the knee just like this, okay? And we're going to add about 10% stretch. Some of these tapes have stretch kind of built in, the elastic properties built in, so you don't have to bother too much with stretching them a ton. Okay? So I'm going to give about, say, 10% stretch there, and I'm going to go right over the area where it's bothering her and kind of contour it around. I know she was wearing lotion, so we'll see how far we get with this thing. There we go, right there. And I'm sure someone's going to criticize my taping. If you do, good for you. I'm sure there's better tapers out there, but this happens to work for me.
And for me.
And for me. So, yeah, if you want to learn proper taping, you should probably go to a course for it. So after this, we've already covered up the area right here. There is imagine like a star right there. I'm just going to cover the star up. Now we're just going to form an X. Okay? I usually rip it in the middle like that, put quite a bit of stretch on it, lay it down, make sure there's not a ton of wrinkles in it. Good to go right there. Next one, again, we rip it in half. Bring it like this. Go right over the area of pain, lay it down, put a little bit of stretch on it. See, she's kind of slippery. And there you go. So we got a taping job right there for a medial meniscus. This will also work for an MCL as well, and sometimes for the pes anserini. A lot of times with this, you can leave it on for about 5 days or so, but you have to make sure that they don't have a bunch of oil on their skin. Also, you can rub and mat it down a little bit more because it is heat activated. Sometimes the adhesive are. And also too, you can put spray underneath it, but I think it's, I didn't need to do it for this purpose here as well, but I will put a link below to where you can find some of this tacky sprays. If you shower with it, it's completely fine, but you just have to make sure you dab it dry off and then just let it air dry.